This video provides guidance for nurses new to working in primary healthcare on how to conduct a health assessment using the example of an ageing person 75 years or older. Health assessments can be performed at any age or life stage and in various primary healthcare settings. Undertaking them provides an opportunity to evaluate a patient's physical, psychological and social function. As a nurse, you will be expected to contribute to the collection of information and use your professional judgment to make recommendations for medical practitioners and other healthcare professionals. Working together as a team means better outcomes for your patients. We hope you find this video useful. Remember to check out our website for supporting information on anything you see here. Before you undertake any type of health assessment, you need to consider how to identify the patients within your practice who are eligible for a particular health assessment, how you will engage with patients to gain their agreement and attendance, where will the health assessment be performed, in the patient's home or in the practice or as a combination of both, what software program, assessment templates, equipment, tools, evidence-based clinical guidelines or best practice guidelines may be required. Are you aware of what may be required within the assessment, from an MBS audit perspective and from a patient needs perspective? Do you have the knowledge, skills and confidence required to undertake this role? Is it within your scope of practice? Have you discussed the roles of the workplace team? For example, which parts of the assessment will be undertaken by you as the nurse and which aspects will be undertaken by others within your practice? Have you considered the ongoing care planning and care coordination which may arise as a result of the health and needs assessment? It is recommended that prior to the patient consultation that you take time to look at the following: previous health assessments or care plans, medications and immunisation, medical, surgical, family and social history, current and past diagnosis, recent notes, specialist letters or referrals, allied health or other healthcare worker services, any past results. Reviewing the patient's past history before they arrive allows you to gain a good understanding of their current and previous health status. Preparing the patient for a health assessment is important and is often done through conversations, pamphlets, letters or information sheets developed through the workplace. The information should include what is involved and the likely benefits, how to book an appointment, approximately how long it will take, how many appointments it may take to complete and with whom. Carers and spouses are often included as they can provide greater clarity or additional information. If you are performing the health assessment within the practice setting, it is also a good idea to ask the patient to bring in all of their medications, including any over-the-counter drugs, to help you gather more accurate information. You may pre-populate the health assessment template with some relevant information from the patient's clinical file. Once you have your patient in the room, as part of your duty of care, you must provide an explanation of the health assessment process and benefits to gain consent. Some of this preliminary information may have been previously provided. However, you should always follow up with a further verbal explanation at the beginning of the consultation. Remember, informed consent must be freely given by the patient or their legal representative following information exchange and through a decision-making process. This means that information relating to the health assessment or process must be explained clearly and in a language that is understood by all the parties. For more information on gaining consent, check the Australian Law Reform Commission website. Along with the patient's existing file, it's important to get to know more about the patient and their history. There are multiple health assessment templates used within clinical software packages, which may set out their questions in a different order. However, if you choose to, you can ask the questions in any order and in a way that feels more comfortable for you. Asking patient history can be a great icebreaker and a way to let the patient know that you're interested in them. The medical benefits schedule or MBS guidelines, provide a summary of the minimal requirements for each health assessment target group, which includes both questioning and physical examination. The physical examinations required will vary. Some are mandatory and some will be based upon the patient and best practice guidelines, but can include height and weight measurement, blood pressure, visual acuity, hearing and ear examinations. As a nurse, it's important that any examinations you undertake are things that you are educated and confident to perform. If you identify a gap in any particular area of knowledge or skill, you need to ensure that you work towards improving that.
So I'm going to ask you a little bit about, the food that you eat at home and shopping and things. Is that okay?
Diet is a key contributor to optimum health throughout every stage of the lifespan. Most Australians do not eat enough vegetables and only half eat enough fruit. A simple questionnaire can establish a baseline risk score, which you can use to check whether nutritional support should be considered and whether further lifestyle and diet conversations are required. There are many tools able to be used to assess mental status. Both the mini mental state examination and the general practitioner assessment of cognition are reliable, valid and efficient instruments to assess areas of cognitive function. Sleep and mood are closely connected. Poor and inadequate sleep can cause irritability and stress, while chronic insomnia may increase the risk of developing a mood disorder, such as anxiety or depression. Asking a few simple questions about sleep and current life stressors can give insight into whether some simple sleep hygiene tips might help. Other patient assessments include independence and social support, continence concerns, functional activity, and home safety. It is worth noting that these assessments sometimes make patients anxious, so it's important they understand that you are trying to identify resources to maintain their independence and quality of life. It is generally agreed that social networks and support are very important for older people, and that higher social support has been associated with better physical and mental health and reduced mortality risks, so these questions are important to ask. Likewise, a few short, well-placed questions relating to a patient's ability to perform self-care tasks such as toileting, dressing, getting to and from the toilet can give enough information to explore other concerns such as incontinence. In particular, functional activity and home safety gives great insight into what services or aids your patient may need to consider. This might include gathering information about their physical home, their history of falls, and their ability to carry out the basic self-care activities of daily living, such as bathing, eating, grooming, toileting, shopping, cooking, and getting up and down stairs. Once you know if they have had any recent falls, you can ask further questions to better understand the frequency and circumstances surrounding falls. As a nurse, you're in a good position to recognise problems and identify patients who would benefit from a medicines management review. These reviews can help identify medication management issues such as, does the person understand what the medication is and why it's been prescribed? Are there discrepancies between what has been prescribed and what the patient has? Are side effects being experienced? Does the patient have any allergies or sensitivities not listed? Are there any administration or adherence problems? Do medication aids or supports exist that can assist safe self-administration? Is the medication still required? For example, a common problem with medication delivered by inhalation devices is that patients may not have a good technique and hence do not get an adequate medication dose. If you can get them to demonstrate how they use their inhaler with you, a teaching opportunity may present itself or an issue can be flagged for future follow-up. Illness prevention involves the encouragement of behaviours that assist in preventing injury or illness. As part of this, it's important to review your patient's vaccination history at the health assessment consultation to identify any risks for vaccine-preventable diseases and to discuss follow-up with your patient. As with all consultation, your notes should identify the patient, document the reason for the visit, Note any relevant examinations, assessments, observations, current management, progress and follow-up recommendations. Your assessment findings can be documented directly into the practice software templates. Some practitioners prefer to document within a paper-based process first to allow them more face-to-face time with the patient. If you are using a hybrid system, we suggest that you follow the guidelines as set out in your organisation or sector's accreditation standards. Documenting the aspects of care which you feel need attention and follow-up can be done in a number of ways. However, it is important to always remember to place any reminders or recalls into the electronic clinical file at appropriate timeframes. See the MBS guidelines relating to the frequency of service for health assessments. The health assessment is completed at a separate appointment with the patient's usual medical practitioner, where a copy of the health assessment will be provided to the patient. It's important to arrange any follow-up appointments before the patient leaves. If the patient would benefit from further care planning, including the development of a management care plan or team care arrangement, then make a follow-up appointment after the health assessment has been finalised. We hope you found this video useful. Remember to check out our website for supporting information on anything you've seen here.